The idea for this book came from a collaboration between Professor Lowell Levin of the School of Public Health in Yale and myself some years ago when I was editing the Journal of Epidemiology and Community Health with Carlos Alvarez from Alicante. And Lowell and I curated a regular aphorism to go in the monthly journal, which illustrated principles of practice of public health. They were short aphorisms. We tried to keep them pithy, and we tried to make them relevant to students who were about to embark on their careers. The aphorisms were well received, and over several years, we accumulated quite a number of them. Our intention was that perhaps one day we would gather them together into a small pocketbook that would be useful to be the focus for discussions in seminars in schools of public health and departments of public health. Sadly, I never got round to doing that with Lowell before he died a couple of years ago at the age of 91. And at his funeral celebration, we had quite a discussion about these aphorisms from some of his ex-colleagues or former colleagues at the Yale School of Public Health. And everyone thought it would be a good idea if I could take this project forward. I hope and I fully expect that this will become a well-used book in the classroom and outside. What I've done is to bring together 50 aphorisms that illustrate many aspects of the principles and practice of public health. We've seen very starkly over the last 12 months with dealing with the COVID pandemic, how the failure to be very practical but drawing on evidence has led to many countries, but not least the United Kingdom, getting into trouble with how it's handled the biggest public health crisis for 100 years. One of my teachers at the London School of Hygiene many years ago, Geoffrey Rose, used to say that in public health, you need a clean mind and dirty hands. And what we hope, Joanna, Lowell's widow, and I, what we hope is that this will provide food for thought for those people who want to go out into the world of public health, practicing in that way. Clean minds, dirty hands, being aware of the science, being aware of the art of public health, and being able to draw from these 50 aphorisms and stories on how to turn theories into practice, making a difference for the human condition, protecting and improving public health.